Welcome. This is a video explainer on who makes decisions about the services and costs of healthcare for people in Connecticut. This is from CT Healthcare Explained. I'm Ellen Andrews, Director of the Connecticut Health Policy Project. This is a difficult and complicated question to answer, but one of the most common that we get. The rules depend on where you get your coverage, and it's even more complex for people with more than one source of coverage. Costs and services. Coverage is only useful if what the patient needs is covered and both the coverage and the service costs are affordable. Unlike in other countries, the decision makers vary by plan and program in the United States. The Affordable Care Act and other laws have standards and requirements around costs and coverage, but there's also wide latitude for insurers and government to set coverage and costs for members and patients. Costs and services covered. For services, insurers negotiate provider rates in private contracts that are very sensitive to market dynamics. In contrast, Medicare and Medicaid set their own rates for services. For drugs, Medicare is now beginning to negotiate fair prices for some drugs. Under federal law, Medicaid receives the best price on drugs for any payer available. Private insurers negotiate drug prices within federal patent and other market protections, and the uninsured are largely at the mercy of providers and drug companies. Private insurance. If you're like most Connecticut residents, you're covered by private insurance. There are standards in the Affordable Care Act and in state law that govern your coverage. Your employer and health plan must work within these legal boundaries when setting your covered services and costs. Until recently, prices paid by private insurers for services and drugs were not available publicly, but that's changing for hospitals. So, who decides what services are covered in private insurance? Federal and state laws set some standards, which are called mandates, and your employer and health plan decide within those standards. Who decides your costs as a consumer? Your employer and health plan decide. In some cases, rates must be approved by the Connecticut Insurance Department. Provider payment rates. Who decides how much providers get paid to care for you? The health plan. They have to fit it within total premiums charged, but they decide how much to pay providers for each service. And who decides on drug prices? That's even more complicated. Drug companies do. PBMs, who are pharmacy benefit managers, these are middlemen between drug companies and employers, and then your employer or your health plan make those decisions. If you're among the 3 in 10 Connecticut residents covered by Medicaid, the state generally decides what will be covered within wide federal standards set by the Centers for Medicare and Medicaid Services, or CMS. The state legislature and the governor set broad policy, but the State Department of Social Services, also called DSS, manages the program. In Connecticut, since we don't have any managed care organizations anymore, all the prices paid are public. So who decides what services are covered? The state legislature does with the governor, and DSS within the standards that are set by federal law and CMS, the Center for Medicare and Medicaid Services. Who decides what consumers pay in Medicaid? There are no consumer costs for Medicaid members in Connecticut, but there are asset limits for some members. That is set by the state legislature, the governor, and DSS within standards set by federal law and CMS. Who decides how much providers get paid? That's determined by the Department of Social Services. What drug prices Medicaid pays? Who decides that? Under federal law, Medicaid gets the lowest price given to any other payers, so it's usually much lower than private insurance. And who decides who's eligible? That is a decision of the state legislature and the governor within standards set by federal law. If you're among the 1 in 20 or 1 in 5 Connecticut residents covered by Medicare, not Medicaid, the federal government makes most decisions about your coverage and what it costs you. Congress and the president set broad policy while the Centers for Medicare and Medicaid Services run the program. If you have chosen a Medicare Advantage plan, your insurer also has some decision-making power. So who decides what services are covered under Medicare? Federal law and CMS make those decisions. Medicare Advantage plans, if you've chosen one, they can choose to offer more services. Unlike Medicaid, there are costs in Medicare for consumers, and those are set by federal law and CMS. Medicare Advantage plans may offer better premiums and lower out-of-pocket costs. Who decides what provider payment rates are in Medicare? Those are set by the Centers for Medicare and Medicaid Services. Experts decide what are fair costs to pay for services in the program. Drug prices, who sets those? It used to be true that Medicare couldn't negotiate drug prices, but that changed in 2022 with the Inflation Reduction Act, and Medicare will begin paying negotiated drug prices in 2025. And that should start saving consumers money. Who decides who's eligible for Medicare? That is set in federal law, passed by Congress and the president. This has been really complicated, and this was just a very short description of this complex process in who decides what services are covered and how much they cost. For help sorting out your concern, you can call the state's Office of Healthcare Advocate. They have experts who know your rights and can sort out the details for you. You can call them at 1-866-466-4446 or email them at healthcare.advocate@ct.gov. I hope this was helpful and helped explain who decides what your plan covers and what it costs. For more information, visit our healthcare spending, insurance, Medicare, Medicaid, and patient rights chapters in CT Healthcare Explained. You can find those at cthealthexplained.org.